Okay. Tell me when, Harry.
I'm waiting on Calvin to cue us.
I think I'll change my background.
All right.
I'm Al Mcfarlane. Welcome to a special session of Conversations with Al Mcfarlane. We're calling this session on Friday, Serving the Underserved. The idea is to meet with leaders in our medical and community organizations, industries, or disciplines to give a conversation, to give you feedback on what we are observing and to hear from you. And I'm pleased to have Dr. Inell Rosario leading this project with me. Dr. Inell, how are you? Good to see you again.
Great, thank you. Glad to be here. A lot to talk about today.
Great. And my colleague, Carmen Robles, is here. Carmen and I work with the Afrodescendientes portion of Insight News and other projects for a long, long time. Thank you, Carmen. How are you?
Doctora Inell, mira, Puerto Rico. Salud.
Yeah, my husband's Puerto Rican, so I feel the love.
Sí, tú también.
Bueno.
Also on this call today, Dr. Barbara Toppin. She was with us, I think, last week and had a great conversation. She's in a private practice for OB-GYN, a women's health clinic, and practices in Woodbury in obstetrics. Am I saying it properly?
Obstetrics, yes.
Obstetrics and gynecology. And we thank you for being with us again, Dr. Toppin. And today we're also joined by Dr. Sean Ennevor. Help me with the name, Ennevor, is that correct?
Ennevor. Good afternoon.
And thank you, good afternoon. And he's a doctor who's graduated with degrees in biology and economics from Stanford and was a Dean Scholar from the UCLA School of Medicine, where he received his MD and did his residency and fellowship in anesthesiology at Yale University. He was chief resident and appointed or voted chief resident by the staff, I think. And he's a published scientific author who practices medicine in Twin Cities, or has practiced over 14 years. So presently he's an advisor and an investor for medical technology companies, as well as a community literacy volunteer. Dr. Ennevor, thank you for being here.
Thank you for having me.
Last person, not least, is my colleague and friend, one of the elders in the neighborhood, one of the soldiers in the community, Jonathan Palmer. Jonathan is the leader, the executive director, president of Hallie Q. Brown Center in St. Paul, one of the legacy institutions. Jonathan, thank you for all you do, and thank you for being here as well.
Glad to be here.
Dr. Rosario, lots to talk about. Let me start with you. What are the main things that are on your mind as we sort of review what's happened in the week and where we go forward?
Well, I think we definitely need to converse about the lack still of education about COVID and ways of treating it. And we really, as yet, do not know a lot about the virus and its behavior. I think one of the things that we were talking about before the start of the program was something that has been in the news as to whether or not people should be drinking Lysol or disinfectants. And so I just want to start off the program, and I wish we could put a bullet point across a streaming message. Do not drink Lysol, please. Do not drink bleach or any other disinfectant. They are not safe for you. It's a respiratory virus. Certainly spraying your surfaces or cleaning your surfaces with those cleaners is safe to do. They are not at all safe for ingestion. The Johnson & Johnson companies come out and said, please do not ingest. Certainly when you spray, say a Lysol spray in the air, you walk through that. So you do get some inhaled, and that's safe, but please do not ingest Lysol. So if there was anything we wanted to start off and make people know is do not ingest.
Let me ask Harry Colbert to jump in. Harry Colbert is managing editor of Insight News. And Harry, you brought the topic up before we started as kind of the hot topic of the day. Give the background on why that's important for us to discuss this issue.
Okay. As kind of the central news item of the day, yesterday during the president's daily briefings on COVID-19, President Donald Trump was speaking with the media and turned to one of his chief medical advisors and said that he heard disinfectants and ultraviolet lights were very effective in killing the virus, which is true when you're talking about on a surface. And he then went to suggest that doctors should look at injecting disinfectants and ultraviolet light into a person. And this was not a sketch on Saturday Night Live. This was not The Onion. This was real life. It happened in real time, live on multiple networks. And it is scary beyond belief that we are here on April 24th, 2020, and this is the conversation we have to start with.
And so, Dr. Toppin, how do you react to that? What do you tell people who may ask you what this really means? Do you think people are, how are people affected by hearing misinformation like this from your point of view?
Well, one newscaster put it that he was being imbecilic. So I would agree with
Dr. Toppin,
that.
I think we're...
I think difference that I think have agreed.
My apologies.
Hello?
Is Dr. Toppin, I think we lost her signal there.
Oh, can you
We
hear
lost our
me
audio.
now?
I see her, but yeah, the audio was not strong. Maybe you can try to adjust the audio, Dr. Toppin, but let me go to Dr. Sean Ennevor. Same question. When you hear this kind of discussion, what comes to mind and what do you want to tell community, patients, friends, neighbors about how we should be responsible and responsive?
I think it's important to gather your own information and be critical of whom's providing that information. The leadership is quick to jump on any kind of solution, which is understandable to allay, but if we're going to use scientific rigor, that's not the way to go about advising people. We do know a little bit about the virus and how it works. Those entities of treatment/management are good, as others just said, for treating it outside of the body, but we don't want to damage the host being ourselves. So ingesting Lysol or UV radiation is not a tenable option for treatment. That being said, we do want to inform people that there are research studies going on with how we can best tackle this virus and how we can approach managing it. But because we do want to use good scientific rigor, that will take time. A lot of what we do know is something that's common to many viruses, and all cells need sugar. And in particular, this virus also needs sugar. And this kind of segues into why people with diabetes, especially type 2, obesity, and other conditions that require glucose don't do well. So we can tackle how we approach treating this virus along that path. Part of what we do know with glucose irregularities is that your immune response is altered. And as a result, we want to maintain glucose effectiveness, if you will, the ability to metabolize that sugar. Lysol does not interfere with that pathway. UV radiation can, but the dose would be so high you would hurt the host being the patient. So that's not a good option. Antivirals, so things that target viruses would be. We are working on those. They're looking at antivirals from other diseases and seeing if they apply to the SARS-CoV-2, which is the formal name for the virus that causes COVID-19. And we're also looking at blocking the whole storm that happens, which is really what's causing the morbidity and mortality, which is just a fancy way of saying the injury to our loved ones, be it hospitalization and or unfortunately death. Part of the way we can do that is blocking that storm of your body's immune response. When your sugar is too high or not regulated, that response is kind of out of control. So what I tell friends and family is that we want to look at things that help that immunoregulation. And those things are out there. Unfortunately, this virus is not a catch-all. It affects people in different ways. And different populations are affected, which we can see that in particular populations of color, populations with poor access to healthcare, often have trouble with glucose metabolism because they don't have the best diets, because they have underlying medical conditions that do have this irregularity in metabolism. So perhaps that's why we're seeing the populations that are really suffering more so than others. So that's one way to combat it. The other would be actual antivirals. And you'll hear a lot of studies that are ongoing and things that try and block the virus. But unfortunately, right now, the FDA has not approved any specific antiviral for SARS-CoV-2 or COVID-19. That doesn't mean things aren't still being looked at. They are. And I'm confident that we will have a solution when it's all said and done. What you can do as an individual, though, is limit your exposure to that virus. And that's the hand washing, the social distancing, and practicing good hygiene and taking care of yourself, keeping your stressors down, which is not easy. But part of the reason you want to do that is when your stress levels are high, a compound called cortisol goes up, and that changes your glucose metabolism, again, your sugar, which then makes you prone to infection from that virus, which then can segue into poor outcomes. So it may be a respiratory virus, but it does affect your other organs.
You mentioned earlier the FDA, and I think earlier this morning, the FDA also came out speaking against the malarial drug. Is it hydrochloroquine? I apologize for not saying the name properly, but that malarial drug that President Trump was touting as possible treatment for COVID-19.
So unless somebody wants to answer, I'll answer. Hydroxychloroquine is an anti-malarial drug that we actually don't really know how it works in regards to malaria. What we do know is it does stop that storm that I mentioned of an immune response. The formal terminology is a cytokine storm, which is a compound that you produce to combat infections. It's an inflammation, though. And that particular drug, we know, interacts in a pathway that stops inflammation. Unfortunately, I don't think it's the same pathway that's triggered by SARS-CoV-2. So you can get inflammation a variety of ways. Just like aspirin can help with swelling and pain, so can Motrin. They're different kinds of drugs and they work at different pathways. So the end result, if we say inflammation is swelling, is the same, but the way you get there differs. So this particular drug, which they were combining with an antibiotic, has been seen not to be effective with SARS-CoV-2. Some people have responded, quote unquote, but there's causation and then there's correlation, which are just fancy ways of saying something that made it happen versus something that's related. So those patients that did well with the anti-malarial drug and the antibiotic had some benefit, but we're not sure why they had a benefit. And in a larger population, we're seeing that that overall benefit is not ideal. And in fact, the risk of taking that drug combination is greater than the benefit. So if I were in a position, or my family, and we're at wit's end, we're running out of options, if you will, perhaps you visit something like that, but the reality is it's not a catch-all and not likely what's going to improve your outcome. A lot of those patients get better because the level of care has been accelerated. They're in an ICU, they're with 24/7 care. That supportive care may be why their body has enough time to respond and fight the virus and all the underlying diseases that get triggered by having that infection. And that's the complexity. It's not always A to B or the egg and then the chicken. We're just seeing little windows into what works and what doesn't. And everyone has to kind of be patient and kind of look outside themselves with overall management for everyone's benefit. And the best thing we can do at this time is prevent the spread, prevent giving, if I have exposure, spreading that to someone else, because we don't have a magic pill. And I don't know that we will have a magic pill anytime soon, but we do have something very powerful. We have a way of taking care of ourselves and others by limiting the spread as best we can. Products like Lysol and UV radiation are good for preventing spread, but in a systems way, meaning in a cleanliness way, if you will, but not, and those would be for inanimate objects, surfaces, but not people. At this point, that would be something that would be more detrimental than good.
I'm Al Mcfarlane. This is Conversations with Al Mcfarlane, our Friday session. We're calling it Serving the Underserved. It's medical professionals and community leaders who are talking about the COVID-19 pandemic, what we need to look at, what we need to know, how do we explain it so that those of us in community can get a handle on what it means and how it affects our lives individually. I am so pleased to have this conversation. And Dr. Ennevor, thank you for what you have said and how you said it. I feel like you're rendering this information in a way that's really accessible to me as one person. And I think that's really important for everybody else as well. And based on that, I'd like for Dr. Toppin and Dr. Rosario sort of to continue the conversation. I'm curious as to how physicians talk to each other and talk to us who are witnessing, observing your conversation as you explain what your knowledge tells you about the impact of COVID-19 in our community on your patients. So Dr. Toppin, maybe from the context of your experience in OBGYN.
Hopefully, can you hear me now?
Yes, we can.
Perfect. Well, it's a daily conversation for us because we are still seeing patients actively as our prenatal patients need to be cared for and delivered. And certainly there are a lot of tears shed because it's always a question of the unknown. Our patients are facing deliveries with their husbands. Still in Minnesota, we're allowed to do this. However, their family members are not able to gather around, come around with them. And so it's not only that our patients are working. Many of our patients are nurses. They're working in that environment. They're caring for COVID patients. They're in nursing homes. So it's a daily basis that we're having these conversations. For the most part, I think it's, again, talking about washing hands, wearing masks when you're out, especially for our prenatal patients who are working in that environment. I have been out and about in stores with necessary shopping, and I see probably only a third of people wearing masks or actually distancing themselves. So there are some people out there not taking it very seriously. I would encourage them to begin to take it seriously with good hand washing. Again, we can't stress this enough. And our patients who are working in that environment, in the hospitals, our nurses who are pregnant, our nurses who are in the operating room, nursing home staff, we're encouraging them to wear their masks. And that's the most important message we can get along. Fortunately, we have not yet had any patients who have been ill. We are looking at the antibody testing. We've had a few antibody tests which have gone out for patients who may have in the past had a cough, did not qualify for, or some sort of illness that they thought might be COVID related, did not qualify for culturing or testing at the time. They are coming in for antibody tests. So there are some things that we're able to do for them now to get to the bottom of it, but time will tell. And this is really the only thing that we can say. If they're ill, we do bring them in, or we encourage getting the testing.
And Dr. Rosario, you are an ENT, ear, nose, and throat physician, obviously interacting with the community, with your customers, your patients. What goes on in your mind as you try to think about how you approach helping people be safe and to be healthy and to do the things they need to do to avoid becoming victims of COVID-19?
Well, we are still open. So I have my clinic in the Inver Grove Heights location is open, and we're seeing patients, some from the ER or primary care doctors for things like nosebleeds or foreign body in the ear or foreign body in the nose. And so always, even before, practiced good hand washing. As an ENT doctor, I absolutely encourage patients to, in addition to everything else that's been said, to rinse their noses. A lot of your infections are inhaled or it is near those surfaces. So I encourage patients to wash their faces each night, or after they've been for a walk, come back at home, wash their faces, rinse their noses out. Just over-the-counter saline spray is great. I've been able to tell patients to gargle with that. And that's what we've done always, even before this, for patients with sinus infections or sore throats. Those are all things that are helpful. The salt is bactericidal and static, depending on what it is. And certainly just decreasing the amount of bacteria or viral load that your body has to deal with is helpful. So in particular for the ENT patients, I remind them on all the things we were doing before: rinsing their nose, rinsing their mouth. For myself and my family and every other person and my patients as well, I try to make sure that, I start off and say, let's breathe, let's relax about this. When you hear of various tragedies and income loss and this loss and everything else, and I'm obviously in that category as well, we can rebuild, but we haven't figured out how to bring the dead back to life yet. So until we can figure out how to bring the dead back to life, let's be willing to at least put on hold some of the other things. Now, having said that, I do think that there are ways that we can go about reopening and having a balance. I do think that, and Dr. Ennevor and myself and some of the other people that are a part of the Minnesota Association of Black Physicians had a conversation last night as to, what do we believe? Do we think everybody should be tested? And I think when I'm asked that question, I'm always wanting to know, well, what are we going to do with the testing results? And will testing everybody then give us that false sense that, okay, you're good, knowing that we can have false positive and false negatives. And we still need to do all of the social distancing, the good hand washing, the rinsing the nose, the wearing the mask. And so I personally think that as we roll out testing for more people, that it should be focused on the healthcare workers. So at the source, it's not getting spread. It should be focused on people that need elective surgeries. They're elective only in that they're not going to die tomorrow. But elective doesn't mean that they are in any way unnecessary. And I mean, we're seeing nurses and doctors be furloughed and laid off. And that in and of itself is pretty stressful. So I would say for patients that are going to need surgeries, they can be tested, or their families can be tested. I think a lot of healthcare clubs can open up. If we're going to ask people to go out for a walk and they have to pass people, I think with the right um, social distancing, to the right protocols, we can have a health club open where, you know, maybe every fourth machine is open, because people do need a way to unwind and to get their stresses out, and in a safe manner. So again, safety first, because again, we can get everything back, but we do not know how to resurrect. So with that in mind, I think we need to more thoughtfully come up with programs, come up with ways of distancing, but at the same time continuing to live and institute good practices.
Dr. Rosario, you had mentioned something that I want to piggyback on, because you said a lot of doctors and nurses are being furloughed and things of that nature. For people outside of the medical profession, explain to them how we can be in the midst of this crisis and yet people in the profession are being laid off. Because one of the pushbacks for those who are denying the severity or the fact that COVID is real, they're saying, well, if it was real, why are doctors and nurses being laid off? Please explain how they're cross disciplines or things of that nature. And this is for any of the doctors who'd like to chime in.
So while we have a lot of patients that are coming down with COVID, when you look at that number compared to how many people would in general use the emergency room, be in the hospital, it pales. So even though, Regents just yesterday or the day before announced that they were laying off, I think it was like maybe, I don't remember the exact number, but say 30 nurses and some doctors, because it's a matter of numbers. So the patients that are coming in are much more critical, and for their staffing would support a regular amount coming in, but a lot of people are staying home, so they're not coming in, and there's just not enough people or coming into the ERs to support that. When you look beyond that to the hospitals, or the hospital itself, when there aren't as many people coming into the ER, when there are no surgeries, a lot of the things that happen on the floor are supported by patients having, in my case, obviously, say a tonsillectomy or a sinus surgery or something for sleep apnea performed, or your gallbladder taken out, or your appendix, or, you know, you name it. From a surgery standpoint, that is what's supporting being able to have nurses on the floor seeing those patients, or, you know, a cardiac procedure. When that is not happening, those nurses then don't have the ability to work. I know a lot of the hospitals have, for nurses that wanted to transition them to helping with the COVID patients, more ICU, but there's only so much, thankfully, right, that we don't have so many COVID patients that all of the nurses and all of the doctors are needed to support them. But at the same time, in trying to conserve resources, there isn't as much work for them to do. And so, yes, despite the COVID, they need to be laid off, because all of the other things, which are multiple times more common, are not happening. So there is no work for them.
Interesting. Let's, Jonathan, bring you in the conversation. You're on the front line in another way. You are the director of a major community resource agency, a legacy institution, the Hallie Q. Brown Community Center, part of the MLK Center in St. Paul. Thank you for joining the program, Jonathan. What's happening with the community that you're in contact with? Are you able to open and provide services to people, or do it in a limited way? What's been the scenario for Hallie Q and the settlement houses that you're part of?
Thank you, Al. The governor had asked for agencies like ours that have food shelves and childcare to stay open. So we've actually been open the entire time. Our operations have been limited to those two areas. So what we have is childcare for children of essential workers still going on. And then we have our food shelf. So the childcare has, of course, been a lot smaller in terms of participation because most people are going with the stay at home and just the essential workers. So we're about half full there. But the food shelf has really grown to a much wider level. We generally see about 30 new individuals in a month. We've seen about 189 in between March and April. And so it is skyrocketed in terms of the number of people that are coming in the doors, and food shelves across the Twin Cities and across the state actually are doing a lot of great work. You know, Sabathani has been staying open, North Point Health and Wellness, and others. So we've been really working hard to try to meet the need. A lot of people have been laid off or come to unemployment, so they're coming, it's their first time for coming to a food shelf, and they don't know exactly what to do. So there's some time spent in helping people understand how to do the things. Many of the food shelves have gone to kind of a pre-packed model where it's just a box that's already done. They can pass that off to us. We're one of the few that has actually stayed with our client choice model. We're not allowing people to come in and shop as we normally would because of social distancing. But we have an online form that they can fill out, or if they come to the center, we have a hard copy, and they just let us know what they don't want within their box, and then our staff and volunteers will go ahead and pack it. We're also doing some delivery out into the community, and we're doing the curbside pickup as people want to as well. So what we're seeing a lot is a greater amount of need, people coming in who have never come in before, and with a lot of the food shelves, the restrictions in terms of geography have been lifted. It's, if you need help, we're here. Just come on in or come give us a call, shoot us an email, whatever it is you need, so that we can hurry up and get food out to people. And that's one of the biggest the challenges that we're seeing around that. We also have masks. We've had some volunteers who have made some great cloth masks. I have a friend, Hal Bishop, who's doing actually geeky ones. This is Black Panther. For anybody who makes a donation to our food shelf. They do a donation, she'll make one for you and send those out. But we're seeing a lot of people coming in, and we're working with information we get from the Minnesota Department of Health to share with people things like the social distancing, things like the smart things that you can do, the actual medical advice that is being recommended from medical professionals versus things that are rumors, and trying to clear up some of the misinformation that's out there.
I'm Al Mcfarlane. This is Conversations with Al Mcfarlane, our regular Friday session. We're calling this Serving the Underserved. It's an idea. The idea is to bring medical and community service professionals in the conversation to talk about the impact of COVID-19 and to try to give, information that people can depend on, trusted sources in our community. And I think this program fits that bill really to the T. Dr. Toppin talked about observing different levels of people conforming to the social distancing in their travel. So I'd like all of you to speak to that. Maybe you could talk more about it, Dr. Toppin, about how do we get people to really embrace this this method for prevention, right? That's number one. And the others of you might be able to do the same conversation. Then thinking back to Dr. Sean's comments about sugar, we are predisposed because of the prevalence of diabetes in our community, right? That's one of the things that gives us an underlying condition that makes us more predisposed or at risk for the COVID-19, the coronavirus. Is there something people can do? Is that a condition that exists because of historic blood sugar levels, or does what people do day to day impact their vulnerability? If you're consuming a lot of sugar, drinking a lot of booze, right? Is what you do right now putting you at risk, yes or no? So that's a general question for Dr. Toppin first and Dr. Sean.
Well, what we can do to help our patients, and what we do to help our patients, is that we have masks that have been donated by other patients who've been making them for us diligently. And if the patients simply ask us for a mask, we're happy to provide the cloth masks that we have here. We are actively encouraging our patients, particularly our prenatal patients, to watch their diets. We do diabetes testing during pregnancy. So that's part of a routine. We do it at the beginning and we do in the middle part. But we're also watching their weight and their diet. So for those who are out there and they're pregnant, and those are primarily who we are addressing, watching their diet, watching their weight, trying to get a little bit of exercise in, even if it means putting on your mask and taking a walk around your block. That may be helpful for those patients to keep their blood sugars down, not gain a lot of weight, because unfortunately this pandemic is lending itself to weight gain, because people are sitting in their houses, they're kind of trapped in there, they've gotten a lot of food and they're kind of eating their pandemic snacks, and so
Yep.
we're encouraging them to put their mask on, take a walk, do the social distancing when they do take a walk. So as things open up a little bit more, they'll be able to get out, or just taking advantage of the home programs. There are home yoga programs, a lot of free exercise in your house programs that we all can benefit from.
Dr. Shaw?
I would just echo what Dr. Toppin and Dr. Rosario said as far as maintaining the distancing, using the barriers, taking care of yourself. All those things are crucial in being protective. A good way I like to convey sugar is glucose is energy. Think of it as fuel. That fuel can be used by your engine or a virus's engine. And the fuel in of itself is not a dangerous thing. It's not like gasoline, which can cause problems. It's more like oxygen. So when you see an overabundance of that fuel, in this case glucose, that's a sign that your body is no longer metabolizing that sugar. And typically that's because the virus or bacteria or some pathogen is the fancy term, is using that to fuel itself. Viruses are not alive per se. It's cellular material. It's got a network and a map, and its goal, not that it's sentient or alive, its goal is to reproduce, and it uses that fuel to reproduce. So when you have an individual that happens to have an overabundance of fuel, in this case glucose, it's an advantage for that virus. That being said, things like movement and diet can then consume some of that fuel. So it doesn't have the opportunity to use it as energy for itself. So if you can move, if you can limit your alcohol ingestion, because alcohol actually is metabolized into sugar, which is probably why people who are consuming alcohol don't do as well with COVID or SARS-CoV-2. It's probably also why those that are vaping and smoking don't do as well. Some of that is sugar, but it's also probably related to the lung damage that goes on from the carcinogens and the smoke inhalation. So there's no simple pathway / explanation for if you do this, then that. But all of it combined could be a good way to protect yourself as best you can. And when you're in a situation where there are no certainties, we're gathering information, there are a lot of good things going on, the thing I recommend is that you continue with that positive outlook. What can I do to improve myself and my position? And one of those things is take care of yourself and take care of those around you. And that's not just your immediate family. That's also those that are in the community. As far as social distancing and masks, a lot of that policy and procedure will be dictated by government authorities, but some of that also requires our guidance. This forum, all of us collectively passing on information so people can do the best they can in the given circumstances. Not everyone has access to the internet, to media. So some of that has to be by word of mouth, by storytelling. We have a lot in history with exposure to disease and our human response. And hopefully we can learn from that and share that with one another so we can be in a better position. We can fixate on the science, but that can be somewhat complex. And then when the leadership is not taking the time to understand what's presented, that's when misinformation comes out. But we do know, or at least hopefully most of us can agree, that movement is essential in life, moving forward in particular, and that can be exercise or even reading a book. Getting sleep is also moving forward because it's restorative. So all those things that you can do to better yourself, that's what I advise. I'm not going to say don't have a glass of wine, don't have that beer, because that can be something that's an outlet for people. Just like too much exercise is not good for you, too much food, too much alcohol is also not good for you. And we kind of don't need others to tell that to us. You can kind of look at yourself and deem, this is when I feel better, and kind of use that as a premise for how to move forward. And then take the magnanimous approach of, this may be good for me, but it may not be good for someone else. So I like to run. I'm going to run with a mask, even though it's better for me not to run with a mask, but I'm going to run with a mask because I want to protect my community. That's the kind of mentality that we can try and empower people with, without making them feel like we're telling them what to do and controlling them. I'm trying to empower you with information, and you can judge for yourself. No matter what we do, people will do as they please when it's all said and done. And hopefully they're looking to experts in the field and contributors to education to gather their information, and being critical and asking questions. So hopefully people continue to do that. And I think we have made a difference with the sacrifice everyone has undertaken. And hopefully that difference will allow us to have the time to come up with some other solutions that are helpful to people.
Is there a lemonade that can come from these lemons that we're dealing with right now? And what I'm speaking of or thinking about is the capacity to encourage all of our ordinary sisters and brothers in community to think differently and to take ownership of their bodies, their minds, their souls in ways we haven't before. Can we educate ourselves in ways that have us understand more fully the kinds of decisions you're talking about us making, that we have the power to make those decisions, and when we make them with intentionality, we will improve, will better our lives? Is this a moment that can redefine, reshape how we as a people look at who we are and what we have to do to be the best people we can be? What do you think?
Well, I think I'll start off then. As I was listening to Sean, Dr. Ennevor, I definitely took a few notes because he's right on. And in answer to your questions from earlier as to, is our current diet, is our current intake affecting our ability to fight this virus? Absolutely. So re-emphasizing, no, even starting now with lessening our, depending on what people bought for their movie snacks, because everybody's watching movies now and sitting at home, lessening the amount of sugar, the amount of carbohydrates, which also gets metabolized to sugar. Fat is pretty much anything that goes straight to fat storage. Everything else gets metabolized to some type of a carbohydrate, sugar. So just being healthier in our diets, more fruits and vegetables, which again is hard to come by in this time frame, but then combining that with movement. And from a sleep standpoint, Dr. Ennevor, right on, emphasizing the need for sleep. We've emphasized that in previous panels. I'd like to bring up again too, just keeping our routines. I think one of the things that'll help keep all of us sane is you might have to write down the day of the week, depending on how old you are, but definitely trying to keep a routine going. This is not the time to say, I have nothing to do, so let me watch movies until 2 in the morning and I get completely out of sort. This is the time to still say, I usually go to bed at this time and I wake up at this time. And I would be at work, but now I'm going to work and maybe I'm going to work out, or I'm going to work and I'm going to take free classes. I mentioned before that all of the Ivy Leagues for sure had all of their online classes for free, no charge. So go ahead, do those, do webinars. I personally today listened to one about LinkedIn. I'm going to be working on my LinkedIn profile while I'm off. So really taking the time to, one, please keep a routine going. Get up, shower. Don't just watch movies all day. Do things, move, like force yourself to keep the same type of routine so that even just from a sleep standpoint and the circadian rhythm, when you go back to work, you're going to have a much easier time converting or just getting up and going to work, as opposed to, whoa, I am usually up at 2 watching a movie. So keeping that routine will mentally and physically keep us stronger. And then we'd mentioned before, and I just want to bring it up again, and we've talked about the ERs. If you're having symptoms of stroke, if your speech is slurred, now we're finding out that COVID sometimes will cause symptoms of a stroke. But if you're having chest pain, the worst headaches ever, still go to the ER. They do have measures in place to make sure and protect us so that we're safe. But all the other things that happen to us still happen irrespective of COVID. So, I'm wanting to make sure and plug that. Don't forget to use the ERs as you have in the past and use them appropriately. And second of all, really don't kid with COVID. In the beginning, it was, okay, this is an elderly person disease. We're finding younger and younger people that are becoming quite ill and dying from it. So I want to encourage everyone to be educated about it. Don't put it off that it's just elderly, because we're having 20, 30-year-olds. I've seen in the news a 5-year-old and a 5-month-old that have all died from this. So we still don't know a lot about it. So please be cautious. Please wash your hands, wash your nose, wear a mask, social distance as we move forward.
We've
We've
come
had
to
to be
the end of our hour. We can have a last comment, though, all the way around. But I want to tell people that are listening or watching on Facebook or on YouTube to like and to share. And we plan to bring these conversations to you every Friday. So maybe you want to do a watch party on Facebook. Our goal is to expand this conversation as widely as possible, bringing people who have information and who have just a precise understanding that will help us all know more and be better. But let me go around and thank everybody for being here. Carmen, I didn't have you saying anything. You're kind of watching, but a comment, because we are trying to connect in a multicultural fashion. And this is important that we understand in our communities all together that we have work to do.
Well, thank you so much, doctors, and the Lighthouse and the community, Allie Q. Brown. Yes, this was so powerful. We talk about this every week at a conference meeting that we have with ethnic media, and getting real-time information to the community in culturally specific manners. And while everybody says, yes, this is important, it seems like, we're falling through this crack again, and we see it. Folks aren't doing social distancing. All the doctors touched upon that. I liked how Dr. Inell talked about putting those things across the screen, wash your hands, wash your nose. I didn't even think about that. Wash your face. I mean, I knew about that, but it's just those little things that we have to do. And mainstream community media is not going to do it. They're not going to do it. They aren't doing it. And so this is so powerful. If we can continue this conversation, then the community themselves can educate themselves. We can educate from the inside out. and help ourselves like we always have in the past. And my heart goes out with Harry because I know that you, just like everybody in the front lines, you're seeing all these horrible things happen with these words that are just thrown out, and people, myself included, I was kind of listening more to the actors than the scientists until my cousin in Puerto Rico, when I told her, oh, I'm going to go for summer for the Christmas in Puerto Rico. She told me, no, 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 this is serious. We haven't even started. So thank you so much, because this is exactly what we need to do is get out there and tell folks, you know, this is, yes, everything's open. You can have your beer, get your hair cut, but this is a very serious thing. And thank you so much for sharing all that information with us. Thank you all for your leadership.
Invite people to know what HalleyQ is doing, if you would. How do they connect with you?
Yep. So you can find us online either through our Facebook page or our website, which is halleyqbrown.org. We've got information. If you need food, if you need help, reach out to us. We'll connect you to the resources. I have been actually profiling each day on my Facebook page and making it public a nonprofit that is still open and operating, because that's one of the things that a lot of people don't realize. We focus a lot on what's going on with grocery clerks who are doing great jobs, and trash people, and as well as the medical professionals. But the nonprofits are also out here. They're helping people. They're providing food. They're going ahead and providing childcare. And the lessons from childcare: wash your hands, go ahead and be respectful. I mean, those are great ones that we're putting out there. We're also having to teach people as they come in our doors that you've got to put on the mask. We have masks that have been donated that we're giving out for free to people, so that they're in our building, they have to have a mask, and then they can take it with them, and keeping the social distance. So be out there. People are working hard, and we're all in this together.
Yeah.
Would you, Dr. Toppin and Dr. Rosario and Dr. Ennevor, close by at least letting people know about your practice, your business, so that they can reach out to you directly for either questions or services? Dr. Toppin?
Surely, I have an OBGYN practice in Woodbury, Minnesota. It's under the name of Adefris and Toppin. There are 6 doctors, and we are here every day. We have 5 RNs triaging patients. So if you have a question, whether you're a patient of ours or not, please feel free to call. Also, I just want to say that we can come out of this on the other side much better. Please have faith in your bodies, have faith in your doctors. You can come out of this better. We are learning every day, and we're learning things like what we don't need to live with anymore. We can have less time. We can have more time with our family. So please have faith in what will be.
And Dr. Ennevor, and then the final word to be Dr. Inell Rosario.
I'd like to echo everyone's sentiments and thank everyone for their contribution and efforts. That positivity is key. I think our community has a tremendous ability to make a difference, not just within our own community, but within others. And part of that is, I think a big message here is keeping that discipline of, if you want to call it cleanliness or organization, so be it. And part of that is your routine. Part of that is practicing those mandates that we've discussed, the distancing, the masks. And then we also want understanding, and I don't have scientific evidence of this, but something that resonates with me is that if sugar is fuel and the virus is using that fuel, as are we, that may explain why the young, the athletic, those that have higher metabolic demands, meaning they consume more sugar, may do better than those of us that are sedentary and have higher sugar levels. So I can't see oxygen to know that it's there. I don't know that how much sugar is in my body necessarily, but I know how I feel, and that's something you can do. So you can be mindful of your diet. You can be mindful of your movement. And in that way, you can clean house of that excess fuel and give less opportunity for that virus to take hold. You are going to have exposure. It's ubiquitous, it's everywhere. But what can you do? You can limit your exposure to others, and it's exposure to your lung surfaces, which is how it's getting in. So I just want to reiterate, please do wear a mask. Any barrier is better than no barrier. And some of it may be more for the benefit of others, but that's a good thing too.
Thank you so much, Dr. Ennevor. And finally, Dr. Rosario, I'll ask you to close the program out, invite people to know your practice, number one, but also you've got another conference going on after this. I think another group we're going to be working with, nurses, are having a conversation today that we can send people to, and maybe say what is on tap, or what are you thinking about for next week's program?
Well, thank you all for being a part of this, and people for listening, and certainly our job in the medical profession in taking that Hippocratic oath, but even being interested in medicine, is to serve and educate people about how they can help themselves, and hopefully then pass this information along to someone that is not hearing it. I'm an otolaryngologist. My clinic, I'm from the Bahamas, don't have much of an accent after being in Minnesota for so long. But it's Andros ENT and Sleep Center, where we do, when we are open, sleep studies. We're doing the home sleep studies now during this period. We can still set people up on CPAP and their masks. And I'm assuming that maybe the governor will open on May 4th, and we'll start to do more testing, but certainly seeing all the emergent or urgent things. And if you don't know if it's urgent or emergent, just call, and we'll go from there. We are doing televisits as well. And for the community as a whole, they can go onto our website, Andros ENT and Sleep Center, and message us through there, or call me from the phone number that's listed there. But for the community as a whole, we really want to emphasize we are going to get through this. Let's keep our routines going. Let's keep a positive mindset. I don't know how many of you are religious or pray, but certainly for myself, I do find that this is a great time to pray and reflect. And whatever your God is, whatever you believe in, know that He is in control. And next week, we are going to continue the conversation with different specialists. I've just been engaging all of the physicians of the Minnesota Association of Black Physicians. So if you want to reach out to me, if I haven't reached out to you yet, my cell is 651-271-7927. Give me a call, and we can talk about your issues on the show, or have you on as well.
Say the number one more time and more slowly, please.
Sorry, 651-271-7927. And no, I'm not crazy, but most of my patients have my cell as well. So
that's great. Listen, thank all of you. Thank you so much. This has been a wonderful conversation. I love the level of calmness that you bring. And so what I'm taking away personally from all of you, doctors and community leaders and organizers, is a sense of calm, and it restores my confidence and my beliefs. So I want to thank you all. And if you're watching this, we want you to chime in, to either ask a question in the future, be part of the coming up programs, and like and share. We want to grow the audience for this, and you are a part of that. We'll see you next time. I'm Al Mcfarlane. Take care.
Yes.
Thanks, guys.
okay, bye.
Adios.
Adios.
Adios, mi amor. Thank you so much. You gave us hope. That's what I came away with. Hope.
It's there. So
it's there. Thank you for giving it back.
have a good one.
Te quiero mucho. Adios.
Thanks, John.